So for male catheter insertion, you would review the patient's chart and check the medical order and make sure that you're supposed to perform this procedure. You would perform hand hygiene and put on proper PPE if indicated, enter the patient's room, identify your patient.
Then we're gonna switch
Check
sides
their
a
ID
bit.
band, make sure you know their date of birth and their name. Explain the procedure to them, make sure they understand what the procedure is, answer any questions if they have them.
Down.
See if they're
And then
allergic to
finally, we're gonna
latex or
switch a little bit
iodine.
more of a corner. Circular motion. And down.
Then you would want to make sure you have proper lighting in the room, adjust the patient's bed to a
After that, we
workable
are ready
height,
to
but make
set
sure
up
they're
our
still
sterile
comfortable.
field. We wanna
They've
make
already
sure that we
adjusted the
have
bed
enough room that we
and
have
put
our
down the
receptacle
rail.
at our disposal. Then we're going to open up.
Once you get your gloves on, you're going to clean the area. So you're gonna
We're gonna use
expose the
plastic bag
patient.
or trash bag.
Place a waterproof pad underneath them. Once you prop up their legs, you don't really have to do this for a male, but I like to spread them just a little bit. Maybe not that far. Just so you open up the area where you're gonna place your sterile field.
I just, that's what I do.
So I'd say for
Right.
So once you place the pad under there, you're gonna take your washcloth and
We're going
make
to
a
take our
mitt.
sterile
you
gloves.
have to take your.
Put these out to the
I
side.
thought about that.
I'm gonna do it on this hand
But
actually.
when you were done with
Say that.
everything.
We're gonna take our tray.
Yeah, I would say when you're done with everything, you can just kind
Yeah,
of.
everything's set up.
And then when you're cleaning,
Close to the
you're
patient.
going to circle, you're gonna hold it with this hand, circle around, and then go
Then
up
we're going to set up our
towards
sterile
the body,
field.
pick
We're
a
gonna
different
take off our
corner,
gloves here.
same thing.
And two, I couldn't show them how to rub everything out.
I think
Okay.
another thing too is holding the end of the catheter.
Different
these
corner.
Back and grabbing the rest
And
of
get
it.
out our
Same
sterile
thing.
I
gloves.
think it's still sterile.
All the way around
but I'm also not entirely
to make sure the area is clean.
sure. She might say something, I don't know, but I was thinking about it, I was like.
Then you will dispose of these gloves.
Well, I think that's good, 'cause I'm looking at a question like, that'd be good, I'll say.
There you go.
Perfect. So I'll have to-
Perform hand hygiene
Sterile gloves I'll
and get ready
question
to
that.
set up
Yeah,
your
yeah, I noticed that I
sterile
actually
field.
grabbed the end of the catheter in the bag together, is that gonna be, is that like?
Perfect, love it. Okay, what else?
Don't be too far away.
Um,
You're gonna use
We wanna
this
make
bag
sure
as a
we don't
trash
touch
bag.
the, finger of the other glove there with our bare
I'm
hand.
gonna place it right here.
Example was, and then you could take me
Put on the other sterile glove.
You can't, what's the thing that you can't have?
Open,
you have to
Away.
say, over here, you have to like spend it, but I don't think it's.
And now we are going to lay down our sterile field or send our sterile field.
Two,
What else?
grab your sterile gloves.
I think at the beginning, one thing, small thing is just making sure that when this is sealed and not.
We're gonna take the shiny end.
On the lock position.
We're gonna do the airplane fold.
It's just
Run that right there.
No, it.
Also wanna make sure how it goes here.
How much cost that time? The lunch comments. And then, when do we put this on? After you attach it to the
So, yeah.
person's leg?
Once you put the.
So then-
And you're like, okay, I inflated the balloon, I know there's.
You'll take
resistance.
your pads
At that point, you
with
can
the shiny
take the
side
catheter,
down,
you can put it on the
airplane
side of
fold
the
up
bed,
here,
And then
yeah.
and
Yeah,
then
you actually have to
place
put
them
that
down
on the leg first,
without
and then
crossing
put it on the side of the bed. Yeah.
your pads to
So
break
try to put it, like,
sterility.
on the side of the bed and
I'm also
put it
gonna use this one and not place it
on.
over.
No, you're good for just going through it.
So I'm gonna make sure that the hole is over the other pad.
Control my guy or no?
Yeah. No, we're good. I can do it real quick. I'm just gonna practice.
And
one
this
time
way I
while
can
you're ready.
Are you?
increase the length
I did mine too.
of my
Then
sterile
after
field.
that, we are going to prepare our tray.
Once I've done that, I'm gonna take my box, place it in here with the tray closer to the patient.
It's okay.
Then
I'll film yours.
I'm going to
Okay.
And then
get
I'll-
my iodine solution,
Are you sure?
pour it in here,
And you'll be able to, like, it'll be enough.
Dispose of
like,
that.
I know it takes a block.
Get my lubricant.
And all that.
Well, I mean, I would obviously.
And then I
eat it
would-
After I
Right.
send it to you.
I just mean like.
So,
is there close?
my cotton balls in the iodine.
Oh,
Are
okay.
you willing to, are you able to kind of like kneel?
Yeah, you do.
Oh, great.
Take off the sheath
I'm
on the
so sorry about
catheter.
that.
Well, I'm sorry,
I've
because,
been trying to like keep it going all day and then it just.
well, your phone uses up.
And then
battery
place it in the
pretty quickly, because I
lubricant,
thought it was like 8%
about 1 to
and
2
then-
inches. Take my saline and attach it. Pull it out a little bit. That would normally be stuck in there. pull it out a little bit so I have some room when I'm inserting. And then I would use my non-dominant hand to hold the penis perpendicular to the body and clean. Going around and up towards the body on all sides. Then taking the fifth one and just cleaning the center and disposing of that. Now you're ready to insert the catheter, so you're going to tell the patient to bear down. Then you're going to begin to insert slowly. For a male, you're going to insert the catheter. If you have any resistance, you're going to twist it around a little bit. For a male, when inserting, you put it all the way up to the Y. Once you get it there, you're going to inflate the balloon.
It's fine. I'm not rushing you anymore, so I'll be okay.
And then take this off. And then once the balloon's inflated, you'll want to tug, make sure it's not going to move. Then you're going to secure the tube to the patient's thigh, giving them a little more room than you would a female. Once you do that, then you will hang your bag below. And then if you need a urine sample, you would do that right now. Do that immediately, and then you would secure this here, clean up your whole area, get the patient back to a comfortable position, perform hand hygiene, and you'd be all set. And then for removal, you would do the same thing, review the chart, make sure the order is necessary for the removal, come in, identify the patient, perform hand hygiene, make sure your lighting's good, adjust the bed, get a waterproof pad underneath. Then you would make sure to empty your bag. Once you empty your bag, you'll detach it from the thigh as well. Make sure you have a pad underneath. Take your syringe, place it in here, and then let the balloon deflate. Make sure your patient's aware of the procedure and they know what's going on. Once the balloon is completely deflated, then you will tell the patient to hold their breath, and you're going to slowly pull the catheter out while coiling it in your hand. Once you get it out, you're going to dispose of it properly, clean the area if necessary, get the patient back to a comfortable position, and then remove your gloves and perform hand hygiene.
Not the best thing.